The difference between Botox and fillers, I have been asked innumerable times. Let me simplify it for you. So Botox is a protein that is injected into your muscle in tiny aliquots in the finest of the needle. What does it do? It kind of helps me take away the lines that come on action. Which means to say when you frown, there's a frown line, I can ease that. When you laugh loud, if there is a lot of crow's feet lines around your eye, that I can ease off. And then there are indications such as muscles which bulk up, like your masseter muscle giving your face a very square face or a broader jaw. So that we can really slim down, so making your contour really nice. Third indication could be anti-aging or preventing aging, such as there are some negatively pulling muscles which pull your face down, like a large muscle called platysma, which pulls the entire lower face down. I can knock that off with tiny little Botox. When do you see the action? Any day between the day 1 to the day 7 of injection. When do you need to repeat it? Once in 3 to 4 months is when you generally repeat it. But in larger muscles such as masseter, it could go on for 6 months, sometimes even for a year. What are the other indications? We do things like hyperhidrosis, migraine headaches, nerve pain such as trigeminal neuralgia are all taken care of with Botox. Yes, this is not just a beauty drug. This is used for many medical indications, even in children for a long period of time. So don't get really worried about it. Now, what is filler? Filler, like the name suggests, is simply something which is a volumizer. I put it somewhere, it sits there and fills that space, giving you the volume. Now, what I do with it is the art and the skill of a doctor that you go. So when there are things which is on a static face, like there is a line which is really deep, use a filler to just take away the depth of the line. You don't like the contour of the face or a structure of the face and you see there's no cheekbone, so this face is kind of coming down. I can give you a beautiful cheekbone to pick it up. We see that the jawline is not too sharp. Maybe some of you have a smaller chin. So you see things collapsing all over here. I can build the jawline, get your chin to a better shape. We could get your nose to a sharper shape. We can make your lips look full and beautiful and hot looking, yeah, youthful looking. We could do all of this with a filler. So you could change the shape of the face, enhance the face, work at it as an anti-aging thing because now you're anchoring the tissue so that everything doesn't collapse down. So you could imagine, and we could do anything with the fillers. You could even work on aging at the back of the hands, on the necklines, all of this. It also helps biostimulate, which means stimulate your own collagen. So this is primarily the difference between the both. How long does the filler last? 2 years to kind of forever. So you need to choose your provider really right. When you see the action, immediate. I keep telling people this is like magic. Like you finish and you can see what's happened. Most often I finish half the face and show the mirror to the patients because the results that I do are very subtle. There have been times when I finish the face and says, can I see anything? I'm just looking fresh. What did you do? So I always show half the face to explain to them what I have done. So when I finish the whole thing, they know the transition. Again, subtle, natural, and it's there to stay for the long time, preventing you from aging or preventing you from tissue to go down. So it's a more support provider from within. That's what it is.